You're listening to Body by Poly. I'm Dr. Alain Polynice, and this podcast is for anyone considering surgery and navigating all the complicated decisions to make before, after, or somewhere in between. Let's talk about what really matters. So, one of the question I want to address today is patients wanting to know, is it better to be the first case of the day for a surgeon when it's surgery day? And that's a very interesting question because I've been operating for many years, and I typically have long days in surgery, and sometimes I'll do multiple cases, or I'll do one long case or two long cases. So, is there a difference between being the first case or the second case? In my opinion, for me, I don't think there's a big difference between the first case and the second case. But once you get into doing 3 or 4 cases in one day and you've been operating for 10 or 12 hours, we're all human. So I do think it does take a toll and it does make a difference. It's not just being physically tired, because even after 10 hours in surgery, it's something I do quite often. I'm not necessarily physically tired, although I am, but it's not something that will prevent me from continuing. But there's also the mental aspect of it, because it's very mentally draining to do these high intensity plastic surgery cases. So now in my practice, I do limit myself. I do 2 cases a day, one case in the morning, take a break for lunch, and one case in the afternoon. I'm very well rested, and you can really feel that the flow is good. So it just creates a really nice vibe. It's not stressful, and that's what you want. You want a very peaceful, calm, non-stressful atmosphere in the operating room. And I think that creates a great environment for the surgeon, the staff, and for the patient. So to answer that question, I've limited myself to doing 2 cases in one surgical day. I may do 3 small cases, but I'll definitely only do one big case, like one mommy makeover case. I'll limit that to 1 case per day and dedicate my full attention to that one patient on that day. Because I do feel that after a while, we're all human. We do get tired. It is very physically demanding to be in the OR. So I try to also limit my OR day to 8 hours, a full day. I guess with time, you develop a sense of what really works for you, but that's what's worked for me in my practice. Thanks for tuning in to Body by Poly. If you found this helpful, hit subscribe and follow along on YouTube, Apple Podcasts, or Spotify. See you next time.